My name is Dr. Jennifer Giordano. I'm a psychiatrist who has a virtual practice based solely on people tapering psychiatric medications. What does that mean exactly? It means I'm helping people who are wanting to reduce their medication level and or ultimately stop them. The thing that I want to point out is most everybody who found me had some kind of difficulty or adverse event because of the information that they were given about how to reduce or stop their psychiatric medication. Sometimes the problems that come up when people try to make adjustments to their medications abruptly are intense symptoms that are bewildering and that are frequently called or attempted to be deemed as relapse. A lot of times a doctor will say, oh, okay, we reduced your medication, cut it in half for a couple of weeks and then in half again and stop. And when people use that kind of advice, what happens not infrequently is that people feel that abrupt change in their brain chemistry. The brain is a highly sensitive organ. It is highly sensitive to abrupt changes. The brain can absolutely adapt. It absolutely can. It's just that the time frame that it takes for the brain to adapt to changes in its fundamental biochemistry is longer than we've traditionally or typically given credit to. So like I said, a lot of times the advising about reducing an antidepressant or a mood stabilizing medication is the 50%, cutting it in half and then in half, or even sometimes a quarter at a time. But usually that's done over the course of maybe a month, maybe 2 months, depends on the individual physician that the person is working with. Any of the other psychiatric medications are not considered to be substances that induce a physiologic dependence. That's where we've gone wrong. That's where we've missed the boat. And if you actually look into the data and the literature and studies, you can actually find plenty of information that validates that withdrawal symptoms are real. It is not necessarily relapse if a person's medication's decreased and they suddenly experience a surge of anxiety, sleep disturbance, mood changes, brain zaps, strange feelings throughout their body, electrical feelings throughout their body, head pain, head pressure, brain pain, all these different sensations and perceptions that people have after they've abruptly discontinued or reduced the medication. That's physiologic. And unfortunately, what we're doing in modern day times is deeming that psychologic. If we look at the science and the exploration through trying to do so through methodical means to understand how to reduce medications, how to stop medications, there's barely any. There's barely any, which would make sense in the whole grand structure of the medical system. The forces that are driving most of our medical studies that are happening today in terms of the funding is coming from big pharma. So there wouldn't be a whole lot of motivation or impetus for people who are financially tied to these medications for them to be exploring and researching about how to help people stop using them. And I think we as a medical community in that regard have certainly failed in helping to protect people in this way. And that's the main thing I think I want to help illuminate in speaking out and advocating. It's been over 4 years where I've strictly done tapering work, and probably over 300 people, I think right by this time, have probably witnessed 50 completed tapers of medications, which take years. Coming off a psychiatric medication that you've been on for even sometimes just over a year or 2 years or 2 decades or 30 years, tapers can take years because your brain and your physiology has become so adapted to that particular biochemical state, that changing that is the time frame to change that is long, which can make sense when we step back and look at it from a common sense point of view. I mean, we understand that for other substances too. We understand that for alcohol. We understand you should not abruptly stop alcohol suddenly if a person has been drinking on a daily basis in large quantities, because that can be life-threatening. Somehow, for some substances, we understand that. But for these particular brain-altering or brain-impacting substances, we're not acknowledging that. And that's where we're falling short. So I think it's twofold in terms of helping people be educated about what they're experiencing as a patient. The other aspect of it is educating and making aware the physician community and the prescriber or provider community, of course. If you've done any research on this topic, which I would recommend anyone to do, simply through the internet, Google. If you do research on this topic, you don't have to go far at all to find out that there are online support groups filled with tens of thousands of people, and that are growing exponentially over the last several years, or however long most of them have been established. They're only growing exponentially. So we have human beings who are struggling and suffering with a common problem that they're experiencing. They're not finding help through the system that initiated the issue for them in the first place. They're doing what humans do, and what do we do when we're hurting and we're struggling and we're in pain and suffering? Is we try to find and seek help. And collectively, human beings are coming together on the internet to try to solve that problem and raise awareness and help each other out, which is beautiful unto itself, but in a way horrible that they're having to do that. My intent is to be an advocate. My intent is to be an advocate for the patients. It's sad that I have a full practice based on people who've been harmed by them. That's the reality. I want to be an advocate for the prescribers. That prescribers are people who want to help people and who want to do the right thing and who want to act from informed, educated choices. So that's my intent of speaking up, raising my voice for the sake of human beings. 1 in 6 of us are on psych meds as Americans. 7 million plus children in the U.S. are on psychiatric medications. It's more than time to ask the questions. It's more than time to start to delve further into this topic as a community. All right, until next time.